Hi, my name is Tiarna Lewis, and today I'm going to discuss Indigenous health and the current and historic innovations. But before I get started, I would like to acknowledge and pay my respects to the people of the Yagamba language region of the Gold Coast, the traditional owners of the land, and all their descendants, both past, present, and emerging. I acknowledge the stories, traditions, and living cultures of Aboriginal and Torres Strait Islander people on this land and commit to building a brighter future together. Before I get started, I would like to discuss the content that we're going to cover. I'm going to define what Indigenous health refers to, who are the Indigenous Australians, the history of Indigenous health, and the national priority to improving the health of Indigenous Australians called Closing the Gap Initiative, Australia's responses to Indigenous health today, and education considerations and initiatives and programs. So, what is Indigenous health? Not only does the absence of disease or physical well-being refer to the health of Indigenous people, but it also refers to the cultural, social, and emotional well-being of Aboriginal and/or Torres Strait Islander people. Additionally, Indigenous health focuses on whole communities to achieve their full potential as human being, thereby bringing about the total well-being of the community. Indigenous Australians are more likely than non-Indigenous Australians to have mental health problems in chronic diseases such as respiratory diseases, cardiovascular diseases, diabetes, and chronic kidney diseases. There are continued high occurrence of certain diseases that are now virtually unknown in the non-Indigenous population. And many Indigenous Australians experience poorer health than other non-Indigenous Australians, and statistics indicate that Indigenous Australians are much less healthy than other non-Indigenous Australians. So who are Indigenous Australians? Indigenous Australians are descended from the people who lived in Australia and the surrounding islands prior to European colonisation. Generally speaking, there are two distinct groups of Indigenous people in Australia: Torres Strait Islanders, who come from the Torres Strait Islands north of Cape York in Queensland, and Aboriginal people who come from all other parts of Australia. Amongst the Aboriginal and Torres Strait Islander communities, there are many different languages, cultures, and beliefs. So when I refer to Indigenous Australians, I'm actually using a collective name to refer to hundreds of diverse groups. In fact, at the time of colonisation, approximately 300 to 700 dialects and languages were spoken by different Indigenous groups throughout Australia. Some of these languages are still spoken in Indigenous communities, and many Indigenous cultures have survived and adapted to colonisation, while others have been actively revived and reclaimed. So the history of Indigenous health. As we all know, in 1770, Lieutenant James Cook claimed possession of the east coast of Australia. Upon his return to Britain, Cook's report inspires the authorities to establish a colony in newly claimed territory. The new colony was intended to alleviate overcrowding in British prisons to expand the British Empire. In 1788, the first fleet arrived with approximately 1,500 convicts, crew, Marines, and civilians arrived at Sydney Cove. In the next 10 years that followed, it is estimated that the Indigenous population of Australia was sadly reduced by 90% due to introduction of new diseases, settler acquisition of Indigenous lands, and violent conflicts with colonisers. The most immediate consequence of colonisation was a wave of epidemic diseases, including smallpox, measles, and influenza. Then skipping ahead to 1971, which was the first ACCHO, or Aboriginal Community Controlled Health Organisations. The first ACCHO was established for local Aboriginal and Torres Strait Islander communities in Redfern in 1971. This was a response to experience of racism in mainstream health services and the unmet need for culturally safe and accessible primary health care. Since then, multiple programs and initiatives have started and implemented in order to improve Indigenous health. And skipping ahead to present day, improving the health of Aboriginal and Torres Strait Islander peoples is a national priority, and closing the gap is a commitment by all Australians to improve the lives of Aboriginal and/or Torres Strait Islander peoples. It aims to it aims to close the gap of Indigenous disadvantage in such areas as health, housing, education, and employment. In health, closing the gap has focused on areas including better access to Medicare and medicines, extra fee immunizations, coordinated care for Aboriginal and Torres Strait Islander people with chronic conditions, and the program to reduce the high rate of smoking among the Indigenous people. So in 2018 to 2019, the financial year, a national Aboriginal and Torres Strait Islander health survey was conducted, and it was compared with another health survey that was conducted in 2012. And the findings are as follows. In 40% of the people had at least one chronic condition, up from 40% in 2012. 17% of people 2 years and over had anxiety, and 13% had depression. 37% of people 15 years and over smoked daily, down from 41% in 2012. 37% of children 2 to 14 years were overweight, obese, but up from 30% in 2012. The proportion of people aged 15 years and over who had consumed the recommended number of services of fruit declined for those in remote areas from 49% in 2012 to 42% in 2018. And more than 1 in 10 of people reported having asthma, which was about the same with 2012, which is approximately about 16%. So education considerations. According to the reports and statistics, Aboriginal Indigenous Australians are disadvantaged according to a range of health outcomes and morbidity profiles. There are a range of resources in their cultural, social, and cognitive lives that teachers can recognize and build upon. Schools are uniquely placed to teach the knowledge, skills, and attitudes that underpin healthy living. The World Health Organization Health Promoting Schools Framework, which uses a whole of school approach to school-based health initiatives, can lead to positive health outcomes for Indigenous students. And quality teaching lie at the heart of initiatives and have successfully enhanced Indigenous students' health and education performance. It is crucial to implement purposeful initiatives to encourage positive health outcomes, and they can be achieved when health education programs are delivered and accessed within a context of school core school curriculum. And this includes incorporating health outcomes in all areas of the curriculum and to embed these skills and knowledge in all the areas of our teaching. Also for teachers to be trained and well-resourced. And one of the main issues when it comes to implement the strategies is the awareness and training of teachers. Teachers should partake in professional development sessions and to find and source resources to ensure that we are teaching students essential life skills and knowledge about their health. The program should also be implemented across a substantial time frame through at least 2 health promoting school dimensions. And teaching and programs should also be informed by local health issues, values, beliefs of individual students and their communities. The resources and teaching must be relevant and current to deal and identify the issues of Indigenous Australians that are currently going through. Additionally, the program should also be delivered in the context of a safe and supportive classroom school environments. In the graduate teaching standards, one of the main priorities is to teach and create and maintain a safe, supportive learning environment. And also the program should also be underpinned by positive partnerships with parents, community members, and health professionals. And throughout my research, I found a range of programs that target many health issues in the Indigenous communities. And these are practical and family focused. So firstly, Healthier Futures Initiative. Access to health services is often limited in remote communities, and clinic visits can be met with anxiety and fear, especially for kids. So Healthier Futures Initiatives is a way where they are entertaining and engaging kids and providing distractions for children and their families during clinic visits, and allowing health professionals to be more productive by keeping children occupied and engaged during their visit. Second, Connected Beginnings. Connected Beginnings aims to improve the lives of Aboriginal and Torres Strait Islander children based on evidence on what works in community building and collaboration from Australia and overseas. The program uses collective impact approach, which brings many people together in a structured way to achieve community-led social change. And third, Healthy Ears, Happy Kids. It is a New South Wales Aboriginal ear health program aims to prevent middle ear infections in Aboriginal children. Health promotion, screening, and early intervention strategies are implemented in public maternity and child and family health services in the Aboriginal community controlled health organisations. The next, Casino Aboriginal Medical Service Fruit and Vegetable Trial. This service, in collaboration with Housing for Health, provide fresh fruit and vegetable boxes to identified households. Families with young children or pregnant women, transport challenges, and known to chronic health or dental conditions were focus of the program. The staff includes a nutritionist, social worker, and Aboriginal health workers to deliver the boxes during home visits and communicate with the families to identify their support needs. The next, Housing for Health. Housing for Health is a health-focused program that aims to improve the health and safety of people, especially children under the age of 5, by ensuring they have access to safe and well-functioning housing and improved living conditions. And next, Save the Day Immunisation Campaign. This immunisation campaign is an annual campaign that aims to improve the understanding and importance of a timely immunization amongst all parents. The campaign includes components that specifically target Aboriginal families. Building Strong Foundation, or BSF. BSF services provide cultural safe child and family health care to Aboriginal children from birth to school entry age and their families. Aboriginal health workers and child and family health nurses provide the service. And this service can be provided in the home, local community health centre, or in places where families feel safe and comfortable. Mr. Germ. Mr. Germ is a hand hygiene education package targeted to 3 to 12-year-olds. Information is provided on when and how to wash your hands and how germs are transferred. Deadly Choices. Deadly Choices is a program designed to encourage Indigenous people aged 13 and over to be positive role models and mentors in reshaping health, lifestyle, and physical activity amongst their family, friends, and networks. Designed for urban Indigenous people in Southeast Queensland, Deadly Choices programs is delivered to Indigenous young people and informs participants to stay strong and healthy and maintain living healthy lifestyles. And lastly, Both Ways Children Service Project. This project involved Indigenous and non-Indigenous researchers working with 6 communities in the Northern Territory. The childcare service of a community demonstrated the successful characteristics of partnerships between health and education service organizations. So innovations in teaching. Health education strategies and practices are critical to improving the health and well-being of Indigenous Australians. Schools in particular are ideal sites for health promotion activities because of their close and regular student-teacher contact. Coverage of formative years, sustained and reinforced permanent delivery, and the capacity to capture all children, irrespective of socio-economic status, ethnicity, or location. Classroom-based health education that develops students' knowledge, personal and interpersonal skills is a fundamental pathway to student health and well-being. It should be embedded in the school curriculum, taught by trained and well-resourced classroom teachers, focus on health knowledge and health literacy competencies, and strategically planned to meet students' developmental age, needs, and local health issues, and informed by parents, community members, and local health professionals. And the evaluation of these strategies. Passing current innovations seeking to provide the educational health disparities of Indigenous youth have provided some clear indications of what does not work. These programs are typically characterized by the quick fix strategies that adopts a one-size-fits-all approach, lack of accountability and sustainability, rely on external speakers or isolating individuals to deliver programs, practices that reinforce deficit models of Indigenous students, and have limited or non-existent quality partnerships with Indigenous families and communities. It is crucial to implement strategies and programs to promote Indigenous health and to continually learn on how to improve our teaching practices. Overall, healthy young people are better learners, and educated young people live healthier lives, including Indigenous young people. Schools in particular are well placed to deliver the knowledge, skills, and attitudes that underpin healthy living. However, current Indigenous health statistics demonstrate the need for more effective delivery of health education to Indigenous young people through Australian schooling. Thanks for listening. And here's my references.